Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
Okay, the patient is pale, they're sweaty, their skin feels cold, and they say they feel dizzy, and something just doesn't look right. Patient looks crook. Sometimes, before the vital signs deteriorate and before diagnosis is even known, the patient simply looks unwell. Well, this might be shock. Shock occurs when the body's organs and tissues are not receiving enough oxygenated blood to meet their needs. Without treatment, shock can rapidly become life-threatening. We've talked about in other episodes causes of shock, types of shock. So let's go through the management of shock today. First of all, ensure the scene is safe. We always start with our primary assessment, DRS ABCD and first D. Shock is a medical emergency and the patient often requires urgent assessment, medication and hospital treatment. If the patient becomes unresponsive and is not breathing normally, commence CPR and follow your DRS ABCD approach. But if the patient is conscious, assist them into a comfortable position. Many patients prefer to lay down because it's easy for the body to pump blood horizontally than it is vertically. The important thing is to avoid unnecessary exertion and allow the patient to remain in the position that they find easiest. If the patient becomes unconscious but is breathing normally, follow our DRS ABCD, place them in the recovery position and continue monitoring the airway and breathing. If there's severe bleeding, let's control it with direct pressure. Remember that significant blood loss is one of the major causes of shock. If oxygen is available and you're trained and authorised to administer, oxygen may be provided. It is also important to maintain body temperature because there is a lack of effective circulating blood volumes to keep the skin warm. So body temperature may drop. Cover the patient with a blanket if they're cold, but avoid overheating someone who already feels too hot. Perhaps one of the most important treatments is reassurance. Patients in shock are often frightened, anxious, and aware that something is wrong. So remain calm, talk to them, monitor them closely, and look for changes in consciousness, breathing, skin colour, pulse, and overall condition. And treat them symptomatically. Because shock is not a diagnosis. It's the body's way of telling you that something serious is happening. And sometimes the first sign of shock is simply a patient who tells you, "I don't feel right."
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.